So if your veterinarian tells you that you need to go see a cardiologist, a lot of people have a lot of anxiety about that. What does that mean? What's going to happen? Typically, it works like this. Your animal will come in and you'll get to talk with a cardiologist, and they'll discuss a plan for you about what they want to do after listening and talking to you about the baby's history. Once we get that information, then we're actually able to say, okay, these are the tests that we want to run to go and look at and get more information about what may be going on. One of the big things that we do is a fancy word, the echocardiogram. The echocardiogram is just an ultrasound of the heart. I don't know why an ultrasound isn't just an ultrasound. When you're ultrasounding a lady who's going to have a baby, they call it a sonogram. When you're ultrasounding somebody's belly, they call it an ultrasound. When you're ultrasounding the heart, they call it an echocardiogram. I didn't make the rules, I'm just telling you what it is. That's how they say it to you. But the echocardiogram is where we go and we'll take an ultrasound probe, put alcohol and gel on it and place it against your baby's chest, and we're actually able to see the heart as it actually beats, as it moves. And we can actually evaluate the strength of the heart, how fast the heart's going, how well and how efficiently it's flowing, if all the blood is going in the right direction, if the chambers of the heart are the right size, if everything's there that's even supposed to be there. So these are some of the things that we can look at. One of the other big parts to this is that when you think about the heart, you want to think of the heart like a house. It has plumbing and it has electrical wiring. So we check the plumbing with the ultrasound. We look at the structure. But the electrical wiring, we look at that with the ECG or the electrocardiogram, or some people call it EKG. I get the question, what's the difference between an ECG and an EKG? And my answer is pretty simple. It depends on if you're German and you spell cardio with a K, or you're English and you spell cardio with the C. They're the same thing. It's electrocardiogram or electrocardiogram. I don't know how the Germans say it, but it's something like that. But that being said, what we look for is the speed of the heart, how fast the heart is going, yet how efficiently it's pumping, and at the same time, is it staying in rhythm? Is our rhythm staying with us so that we're not seeing any types of abnormalities that we would consider a pathologic or a bad type of arrhythmia. Some arrhythmias are okay and some arrhythmias can be harmful. That's what we'd be looking at. Then depending on what else your baby needs, sometimes we'll do x-rays of the chest, or we may do a blood pressure to give us a better idea or a more complete idea if there are other things going on that we don't think we have a good handle on. But in general, that's what you're looking at. Depending on the cardiologist, some cardiologists will take your baby away from you and go do this, while other cardiologists will do this right in front of you. So it just depends on your cardiology and that cardiology team. Just to ask. So I really appreciate you guys for stopping in and taking time. Hopefully we'll keep good content coming your way. Please hit that like or subscribe button that's somewhere around me in the ethereal space. I don't know where it is, but really appreciate you and can't wait to see you again on the next video.